We're with Dr. Olivier today, and we're hoping that he's going to be able to shed some informative light on swine flu, which we know is in a little bit of people in a state of panic at the moment. And I know that at schools in particular, the story is getting not necessarily blown out of proportion, but things are not understood by children, which possibly comes from not being understood completely by the parents. So I was wondering if you can just fill in the gaps really on, first of all, how worried need we be right now?
Okay, that's a good question. I see in my practice a lot of people who are extremely worried, paranoid, a lot of phone calls, and I think it happens all over the country at the moment. The reason for that being that there has been some flu epidemics in the past few centuries that really has been devastating. I think that's the historics to it. And this new pandemic flu, or swine flu, we didn't really understand it or how severe it would be. Now, fortunately, we've got lots of data. And the interesting thing actually is that it's a mild to moderate risk by the World Health Organization just been issued, which puts it exactly at the same level of normal, common, old flu which we get every year. And the risk, therefore, is no more than just that.
Okay, but we've heard recently for people who've been following the news, that it's more people who are in the high risk bracket. That's basically compromised immune systems, lung problems, heart, etc. Is that correct?
Every year, every new strain of flu virus, and this is actually a total new strain. That's the difference between this and the normal common influenza which we'll see. So this flu, for instance, we have no immunity to it. It's a total new strain, total new mutation. Next year we'll be accustomed to it, and even if it does change, we'll be accustomed to it partially. But basically, theoretically, it's a total new viral strain, therefore everybody could get it. But you're very right, there are high-risk categories, and with every flu, every year, the flu almost targets a certain age group, if you like, and therefore there are certain high-risk groups every year which is different. Now, this flu seems to target the 10 to 45-year-old age group, which is really the kids that go to high school and the young working adult population. They're the most at risk. Fortunately, for the human population, they are normally the most healthy of the population as well. So that fortunately makes the whole scenario much safer. And yes, there are quite a few people which they have been identified as high-risk groups. And I can tell you if you like, They basically are pregnant women. Because pregnant women, we don't always have safety data with medication. And of course you've got a baby inside which you also need to treat, and that makes you a high risk group. So if you have a high fever and severe body aches and pains from flu and you're pregnant, that puts you in a high risk category, obviously. People with diabetes or HIV, their immune system is already compromised, and therefore they are much more susceptible to the influenza virus itself and to secondary infections, which put them at a high risk. Another group is the elderly people in general. So normally people that 65 and older are a high risk group. Another high risk group are children that take immunosuppressants. In the government sector, some kids need to take aspirin for a prolonged period of time. That puts them at a higher risk. We're talking years of use here. Not just aspirin for a week or so. And then the very young, small children, younger than 5, because their lung system are not so well developed yet, and therefore they can get much sicker. But as I said in the beginning, this flu targets really the 10 to 45-year-old age group, and therefore we don't have to worry too much.
Because right at the beginning of this whole thing, it was labeled really a deadly flu. But now, I'm not sure if I'm correct on this, which is why we're here, but the deaths that have occurred, they're really from the complications. Is that from some sort of compromised?
I think we need to be quite clear with the whole thing about death and flu. Flu itself can kill you.
Right.
That's the reality. And the incidence of the flu killing people is now researched to say 4 people out of 1,000 people that get the flu will die from it. Which is a low risk, it's 0.4%.
Right.
But still, it means 4 people out of 1,000 people that get it will die.
Right.
Which is actually quite high if it happens to be you or your mother or your father. If you are immunocompromised, then that will more likely be that person than the healthy person.
What I wanted to know is how it's being treated.
Okay. Let's talk about how it's being spread.
Right, okay.
And what can you do as an individual to try and minimize the spread. If you have flu-like symptoms and they really are a temperature of 38 and more,
okay,
muscle pains, joint pains, body pains that starts with that fever, rapid onset, starts very rapidly. Sore throat, headache, bunged up head, runny nose. Then it's very likely that you've got influenza.
Yes.
And we can debate whether it's now the swine flu or the normal flu or a pandemic flu. It doesn't really matter. The laboratories that does the testing are totally inundated and cannot cope with the load. So it will take more than 5 days for them to give us an answer. So it really is very fruitless to do the tests. We only do the test for people that we admit to hospital that are so sick that we really need to decide what to do, but we'll treat them anyway while we're waiting for the 5 days. So we don't bother doing tests in the normal general practitioner setting. If we diagnose the person then with that flu, we'll give them an antiviral called Tamiflu or Relenza, which works very effectively against the normal flu, and it has a good effect on this flu as well. Other measures is bring your temperature down, to take something like paracetamol, drink a lot of fluids. The more fluids you drink, the more you urinate, and you urinate viral particles. So get rid of them. That's a wonderful way. And it keeps you well hydrated, prevents you from becoming dehydrated. It is very, very important. Then other very simple things. If I see somebody at my office with I suspect them to have flu, I give them a face mask. Because they're going to walk through town on their way home, and every cough they give, every sneeze, they will spread viruses. So prevent from spreading. I'm giving them a mask, but in essence I'm telling them, go home, stay home, don't go into the community because you're going to spread the virus. And the good advice is to stay away from other people for 7 days.
That's what I was
That's
going to
the
ask you.
period of time, and it doesn't really matter whether you feel all that much better or not. That's the time that it takes for you to stop spreading the virus.
Right, because often after 3 to 4 days of flu, people do feel better. So recommendation is
7 days. That's the recommendation.
Own little creative quarantine, really.
Excellent, actually, yes. Okay. Other things that is very, very important, don't use cloth material to blow your nose, like a handkerchief. Rather use throwaway tissues. And keep your hand in front of your mouth when you cough, and wash your hands regularly. Very regular hand washing drops the viral load quite a lot in the community.
And the window period?
Window period can be as short as 6 hours.
Gosh, okay.
Can be as short as 6 hours, and apparently is around about 2 to 3 days, but can be as long as 2 weeks as well.
The other question I wanted to ask you is the medication, the specific medication for swine flu. Is there a supply of it? Is it stockpiled in our area or not?
At the moment, I have had no problems giving Tamiflu or Sultamivir or Relenza to people that need it.
Okay.
So I don't think there's an issue with that. I think there is good supplies. There's many generics. There's one generic on the market, which is just as good as Tamiflu. So I haven't had any problems with that.
Okay. Is there any other advice you'd like to give your community, basically?
Well, the normal rule in prevention of anything like particularly viral infections is Stay healthy, and staying healthy means exercise moderately, eat vegetables, eat salads and fruit, don't smoke, don't drink too much, don't be in the sun too much, moderation, and exercise and fruit and vegetables and salads. That's your golden key.
Golden key, keep healthy. So there we go. Thank you so much for allowing us to come to your office today.
You're very welcome. Voila.